I just added, if you're not here that day, or if you just didn't do whatever it was, you didn't turn it in, I just add everything to Schoology and I attach. That's why you see like numbers. That's how many people didn't turn something in. I just directly attach it to you. So make sure you're going into the makeup work folder and looking to see if you have anything attached to your name. Um, if not, then you should be good. I think I gave y'all sticky notes today if you were missing stuff. If you need a quiz, you need it on paper. I made paper copies the other day. So if you need to take something on paper, next week I'll only see y'all on Thursday because of testing on Tuesday for 10th graders. Remember, only 10th graders will come to school on Tuesday. Tuesday for everybody else, 9th, 11th, and 12th will be a virtual learning day or asynchronous learning day. So that'll be the time if you're missing anything to get stuff completed. Next Thursday, you will take a test over this healthcare delivery system unit we've been going on. I've made copies of the study guide, paper copies. If you want a paper copy, you can grab one. It will be on Schoology. You can turn it in that way if you want to. Either way, I don't care if you do it on paper. If you do it on paper, you'll turn it in here. It'll be due on Thursday, the day of the test. You can submit it on Schoology. Doesn't matter. Just one of the two ways. So y'all can grab that. You should be able to fill it out today. Because y'all are ahead of my other classes. Y'all will have all the notes when we get done in a few minutes. So once we get done with the quiz, if you got stuff you need to make up, let me know so I can get it to you so y'all can use this day as kind of a makeup work day if you're missing anything. Anybody have questions?
Is the safety test on paper?
I have it on paper. It's also on Schoology. So anything you need, if you need it on paper, then you let me know. So we'll use that time for y'all we can start working on. So, because grades go in next Friday, or that's the last day for grades to be turned in, and then y'all get report cards on the 21st that following week. So, some people that I've already spoken to them that's partners for their project that are quarantined or haven't come back yet. You'll have a little bit more time for your project since your person is quarantined, your partner is quarantined.
Oh, so why you got to bring this project in?
Oh, you said you were doing it by yourself.
He ended up texting me.
Oh, he did. Oh, yeah.
My wife was talking about the project.
Huh?
I can grab the study guide now.
You want to study guide? You can grab it. All right, if you're done with your project, you can put it behind that box that comes to my desk. They're just sticking them behind. You can put it behind there. All right, so the other day when whatever happened and the internet went down, we were right here talking about Rita and Marcus. All right, so Rita found out a few weeks ago that she is pregnant. She and her husband Marcus are very happy. They will visit the doctor approximately 10 times during the next 9 months. In addition, they expect a hospital bill of about $5,000. Assume that the premium for each plan is the same and that Rita and Marcus plan to visit an in-network physician. Which plan has the lowest out-of-pocket cost for Rita and Marcus? All right, so with the HMO plan, they need to pay a $10 copay for each doctor visit. The deductible for the HMO plan is $750, so that's what they have to meet for that year before the insurance plan kicks in and starts covering stuff. Since Rita and Marcus have not needed any medical care this year, they must pay the entire deductible. After the deductible is paid, the HMO will cover 100% of the remaining hospital expenses. So if they meet that $750, after that the hospital will pay 100%. All right, so for the PPO plan, it includes a $20 copayment for each doctor visit. The PPO plan also requires a $100 copayment for Rita's hospital stay when she delivers a baby. Rita and Marcus must also pay a $500 deductible. All other hospital expenses will be covered by the PPO at 100%. And then the EPO plan, this plan has a $15 copayment for each doctor visit. There is a $1,000 deductible that applies only to hospital stays. After the deductible, the EPO will cover 80% of hospital expenses. And then you have the POS plan. The copayment for each doctor visit is $10. There is no deductible for the POS plan. All hospital expenses will be covered by the POS at 90%. Huh? That box right there by that blackboard. It's a box. You can stick it behind them.
Evaluating the plan. The out-of-pocket.
All right, so looking at it, the out-of-pocket cost for Rita and Marcus depends on the coverage of the insurance plan. Remember that they will visit the doctor's office 10 times during the pregnancy. Also, remember that hospital expenses will be $5,000. For the HMO plan, the copayment is $10 per doctor visit. With 10 visits to the doctor, Rita and Marcus will pay $100 in copayment because that's 10 times 10. The deductible is another $750. All other expenses will be covered by the HMO at 100%. Therefore, the out-of-pocket cost for the HMO plan is $850. So this is what they'll end up paying out of pocket because they have to meet this deductible first. But since they don't go to the doctor often, only once a month, they're gonna end up having to come out of pocket for that. All right, so then with the PPO plan, the copayment for each doctor visit is $20. With 10 doctors visit, Rita and Marcus will pay $200 in copayment. The copayment for the hospital stay is another $100. The deductible is an additional $500. All other expenses will be covered by the PPO at 100%. Therefore, the out-of-pocket cost for the PPO plan is $800. So here they're saving $50 between the HMO and the PPO. And then the EPO plan, the copayment for each doctor visit is $15 with 10 doctors visits. Rita and Marcus will pay $150 in copayment. The EPO has a $1,000 deductible that will be applied to the $5,000 hospital bill. This leaves $4,000, of which 80% will be covered by the plan. 80% of $4,000 is $3,200. Rita and Marcus will be responsible for paying the remaining $800. Therefore, the out-of-pocket cost for the EPO plan is $950. And then with the POS plan, the copayment for each doctor visit is $10. With 10 doctor's visits, Rita and Marcus will pay $100 in copayments. There is no deductible. The POS will cover 90% of the $5,000 hospital bill. 90% of $5,000 is $4,500. Rita and Marcus must pay the remaining $500. Therefore, the out-of-pocket cost for the POS plan is $600. So the POS plan offers coverage at only 90%. However, the POS plan also has no deductible. This means that for Marcus and Rita's situation, the POS plan has the lowest out-of-pocket cost. So that'll be the cheaper of all of them for them. If you look at this chart, it tells you what their copay is, deductible. So see, $750, $500, $1,000. These deductibles are what they have to meet in order for the insurance company to pay. So once they meet the deductible, the HMO will pay it 100%. Also, the PPO will pay it 100%. EPO is 80%, and then POS is 90%. So this is their out-of-pocket, what they'll actually have to come out of pocket to pay.
Tyrone, if what you'll learn after you finish what you'll learn. Rita and Marcus. Evaluating the plan. Tyrone. Tyrone is a single man in his early 30s. He is active and healthy, but today.
All right. So now we're talking about Tyrone. He's single. He's in his early 30s. He's active and healthy, but he is sick and needs to see his doctor. So assume that the premium for each plan is the same and that Tyrone will visit an out-of-network provider for his sick visit. The charge for the sick visit is $150, and Tyrone has not met his deductible yet for the year. Which plan has the lowest out-of-pocket cost for Tyrone? So with the HMO plan, sick visits are a $40 copayment for in-network providers. There is no out-of-pocket coverage. The deductible for the plan is $500. After the deductible has been paid, all in-network expenses are covered at 90%. With the PPO plan, copayments are $20 if it's in-network, $40 if it's out-of-network. The deductible for the plan is $250. After the deductible has been paid, expenses are covered at 90%. EPO plan, there's no out-of-network coverage except in cases of emergency. And then with the POS plan, co-payments for doctor visits are $10 for in-network providers, $20 for out-of-network providers, and the POS plan has no deductible.
Evaluating the plans.
All right, so out-of-pocket cost for him depends on which one of the insurance plan that he chose. So remember that his doctor's appointment costs $150, but he has not met his deductible. So with the HMO plan, they don't have out of network coverage. So since he plans to see somebody that's out of his network, he will have to pay the whole $150. So with the PPO plan, co-payments if you're out of network is $40, the deductible is $250. After he meets that $250 deductible, everything else is covered at 90%. Because he hasn't met his deductible, he's still gonna come out of pocket for $150. With the EPO plan, they don't have out-of-network coverage, so we know already that he wants to see somebody out-of-network. He's still gonna be responsible for $150. With the POS plan, co-payments for out-of-network doctor's visits are $20. There's no deductible, so he's gonna pay $20 co-payment, and that's it. So that's how much, if he chooses this one, he'll save money. The POS plan.
Michael. Michael is.
All right, so Michael is in his 50s. He had some heart problems. So once he went to his regular doctor, he got referred to a cardiologist. That's somebody that studies the heart. So he goes to an out-of-network cardiologist 4 times a year to monitor his heart condition. Each visit is $150. In addition, Michael's heart tests and treatments are $6,000 per year. Assume that the premium for each plan is the same. Which plan has the lowest out-of-pocket cost for Michael? So with HMO, for in-network, co-payments are $10. Doesn't cover out-of-network. Deductible is $750. After that's been met, everything else will be covered at 100%. Then you have your PPO plan. Co-payments are $15 for in-network, $30 for out-of-network. Deductible is $500. After the deductible has been paid, all other expenses are covered at 100%. For the EPO plan, co-payments for doctor's visits are $15 for in-network providers. Out-of-network providers are not covered except when you have an emergency. Deductible is $750. After the deductible has been paid, all remaining tests and treatment expenses are covered at 90%. Then you have the POS plan. Co-payments for doctor visits are $20 for in-network, $40 for out-of-network. POS plan has no deductible. All other expenses are covered at 90%.
Evaluating the plans.
So with Michael, it's of course gonna depend on which plan he chooses. But we know he's going out of network to see a cardiologist, so HMO won't be it because he's gonna be out of pocket $6,600. PPO does cover out of network. His out of pocket for that will be $620. EPO doesn't cover out of network, so he's gonna be out of pocket the full $6,600. POS co-payments are $40, and he goes 4 times a year, so that's $160. It'll cover 90% of other expenses. 90% of that is $5,400. So he has to pay the remaining $600. So because of his co-payments that he pays $160 plus this $600 that's left over, he'll pay $760.
Making informed decisions.
All right, so HMOs, PPOs, EPOs, and POS plans provide medical coverage that is suitable in most cases. The most cost-effective plan depends on the individual's healthcare need and the coverage included in the specific plan. Even within the same type of managed care plan, the cost to the insured individual can vary. Anyone who buys health insurance should research and compare the types of plans that are available. Likewise, people who know in advance that they will need extensive health care should research prices for the expected care. Bless you. This will enable each person to predict the out-of-pocket costs, if any, based on the health plan. It is important to make informed decisions about healthcare. So with everything, you need to make sure that you're researching. When you have to start getting insurance, like when you get on your own and have to get your own insurance, I mean, look at it. Like if you're single, of course it's going to be cheaper because you just covered, have to be covered for yourself. When you start getting families, like you get a family, get kids, even though you might have one kid and family coverage might be $500 or $300, depending on how often you get your paycheck. So it just depends. And then they have stuff that you can add on for insurance. Like say for example, if you have a history of cancer in your family, you might want to add a cancer policy. They have things like accident policies. Something else they have. So it just depends. Like just research it all when y'all get ready to, start making those decisions. Or make your mama do it.
Lesson summary. In this lesson,
all right, so this is the last
what you'll
section. We're going to talk about government programs.
Public health insurance program.
All right, so with public health insurance programs, the federal government finances healthcare services received by eligible groups of the population. More than 1/3 of the U.S. population is covered by a public health insurance program. So you got Medicaid, Medicare, Military Health System, TRICARE, and Veterans Health Administration.
Government programs.
All right, since 1966, government funding of healthcare services has expanded access to these services to millions of Americans. The U.S. government began to realize the need for public medical assistance and instituted 2 medical assistance programs to help those without health insurance. So you have Medicaid and Medicare. 2010, President Obama signed the Patient Protection and Affordable Care Act of 2010, or ACA, we talked about that previously, into law. It's a healthcare reform bill that expanded access to healthcare services. So before he signed this into law, some of this stuff was not covered in insurance policies. This law passed with the goal of reducing the number of uninsured individuals in the United States by doing 2 things: expanding the eligibility criteria for Medicaid, providing financial assistance for middle-income Americans that do not qualify for Medicaid and or do not have access to employer-sponsored healthcare coverage. Providing and funding healthcare services for all Americans continues to be a challenge in the United States. So it's always going to be something that's not covered or somebody can't qualify.
Medicaid.
All right, so Medicaid is a need-based program that was designed by the federal government. However, it is administered by state governments. Medicaid is a voluntary program which states may or may not choose to participate in. Of course, our state has a Medicaid program. Medicaid provides healthcare coverage to individuals and families who are low income or medically needy. Each state must determine its own definition of medically needy. Those that qualify for Medicaid include low income individuals and families, low income pregnant women, families with adopted or foster kids, blind or disabled adults, adults and children with certain chronic or debilitating diseases, adults and children who receive Social Security benefits. So my daughter has Medicaid and we just got it a year. Of course she has my insurance. But the reason she could get it because we don't meet the financial requirements of it. Like they say we make too much money. Because she falls under here, she has certain chronic or debilitating diseases, then she qualifies for that. But of course, when you have stuff like that, they're not just gonna give it to you. You got to prove it. So it's like paperwork, doctor has to fill out to say this, and all other stuff, So when they look at these things, of course, it has to be, proof that you are low income and you're pregnant or you don't make enough money. It's like different. It depends on like how many people in the house. You can make this amount. This amount. Like if you fall within those numbers, then you can qualify.
Medicaid services. In addition to the
All right, so in addition to deciding who qualifies for Medicaid, states must also define the type, amount, duration, and scope of the services. Services vary from state to state, but they typically include inpatient and outpatient hospital services, prenatal care, child vaccines, pediatric services, physician services, diagnostic testing and x-rays, rehab and physical therapy, prescription drug coverage, and home health care. Um,
Medicaid expansion.
All right, so the ACA provides the foundation for Medicaid expansion since it is a voluntary program and states may decide whether or not to participate. States also decide whether or not to expand Medicaid for their residents. As of May 2019, 37 states, including Washington, D.C., have elected to expand Medicaid, and 14 states have decided against it. Expansion allows residents to qualify for up to 138% of the federal poverty level. This includes access for non-disabled adults. Prior to ACA, if a low-income individual did not have children or was not disabled, they likely did not qualify for Medicaid or among the uninsured. So that's why President Obama signed the ACA into effect, because people were going without having insurance because they wasn't meeting some of these qualifications. So that's why they added all that stuff. All right, so who is in charge of Medicaid? State government is in charge of Medicaid. I think y'all need to know that. I think. Yes. Medicaid is run by the state government. Y'all need to know that. Medicaid is run by the state government. All states have expanded Medicaid. False. Another thing you need to know about Medicaid is that not all low-income individuals can get it. They won't qualify. Not all low-income individuals will qualify for Medicaid. Even though if you might not meet you might meet the income qualifications, you still might not qualify for it. So not all low-income individuals will qualify for Medicaid.
Medicare.
All right, so Medicare program is administered by the federal government. Unlike Medicaid, which is a needs-based program, Medicare is an entitlement program. This program provides healthcare coverage to three groups. So individuals 65 or older, disabled individuals receiving Social Security disability benefits, and then individuals with end-stage renal disease, which means they have permanent kidney failure. Um, Medicare will not cover all of an individual's healthcare expenses. The insured persons are required to pay a yearly deductible. After the deductible, Medicare will cover 85% of all expenses. This means that insured persons must pay the remaining 20%, similar to co-insurance. Many people cannot afford to pay the 20% charge. An additional form of insurance called Medigap may be purchased to help cover the remaining expenses.
Medicare services.
All right, so Medicare is divided into Part A and Part B. So Part A is hospital. It's hospitalization, skilled nursing facilities, home health care, hospice care, and long-term care facilities. So these are the things that are covered in the Part A. So know that Part A of Medicare is hospital care. Part A of Medicare is hospital care. So then Part B is outpatient services. So what's covered is medical expenses, including physician services, physical therapy, occupational therapy, speech therapy, medical equipment, and diagnostic testing, and also preventative care. But all you need to know is Part A of Medicare is hospital care.
We gotta write down the book.
All right, people receiving Medicare are required to pay a yearly deductible. That's true. Which type of care does Medicare Type A provide? Hospital care. All right, so what goes under Medicaid?
Administrative. And then the federal government going to Medicare. Medicaid for needy families and individuals.
Needy families
No,
and
no. Needy
What?
families and individuals.
Oh,
I ain't never say where they go.
Or those over 65 go to Medicare.
Yeah, they go to Medicare. Entitlement programs go to Medicare. This wrong.
what?
So, I guess they go underneath they cover.
Right. All right, so Medicaid is administered by state. It's for needy families and individuals, and it's needs-based. Medicare is federal adults over 65, and it's entitlement.
Health care for the military.
All right, so U.S. Department of Defense operates a military health system which provides medical services to active duty, retired military members of the armed forces and their families. It also provides services to members of the National Guard and Reserves. The Army, Navy, and Air Force each operate their own hospitals and clinics to provide services to over 9.6 million beneficiaries around the world. TRICARE is a health insurance program of the military health system. This program allows beneficiaries to access care within the military health system or from providers outside of the system. There are several different TRICARE health plans with many different options depending on whether the beneficiary lives in the United States or overseas. So for TRICARE, you just need to know that it is for active duty and retired military families, members and families. It's TRICARE provides medical services to active duty and retired military members and their families. So if you got a family member that's retired, active duty, reserve, National Guard, they're able to get TRICARE and their family members. So we have, well, my husband is Air Force Reserve, and we have TRICARE sometimes, like when he goes active duty status, which he does sometimes, then we'll have TRICARE. But I got my, I keep my insurance, so it kind of goes in and out depending on if his status changes. But like TRICARE is kind of strict with stuff, so you gotta have a referral for everything. So you have to go to your regular doctor, and that regular doctor has the right referrals for you to go see all these other people. So, only thing I don't like about it. All right, so Veterans Health Administration is the largest integrated health service system in the United States. It provides medical services to 8.76 million veterans and more than 1,700 sites of care that includes hospitals, outpatient clinics, and nursing homes. The VHA was originally established to treat and rehabilitate veterans with war-related injuries or disabilities. Today, the VHA has expanded, with most of the care provided being non-service related to low-income veterans and those with special health needs. What is a military health system health insurance program? TRICARE. What is the largest integrated health services system in the United States? VHA. Huh? No, I did not.
Lesson 7.
All right, so we are done with healthcare economics. We are done with all of these actually. Your study guide, your notes, your bell ringers, all those things should help you be able to answer the questions. I would just look at my notes. I would not go to Google, because Google for answer probably is not going to be on your test. I don't know why y'all like to do that, but y'all like to Google it when you got the stuff right there if you took your notes. But that's another story for a different day. All right, we're about to take a quiz over this material. If you need a paper copy, I have one. And then you need to work on any work that you're missing. If you need a copy of something. Yes, just let me know after we get on. How many questions? I think it's 13. Oh, I hit the wrong thing. I think it's like 13 questions. 13 questions from 5 notes. You should have more than. No, I said from Monday, Wednesday, Friday notes. Oh, you weren't in here when I said it. Monday, Wednesday, Friday notes. I think I gave y'all 2 minutes per question. Y'all should need that long. Huh? Just I know folks be trying to look at their notes. Who needs a paper copy of this quiz? 1, 2, 3, 4, 5, 6. Is this what? Yes. For the notes. That's from the last quiz. They look confusing. What you giving out? No, it's not gonna start until I hit start. I gotta have it. Got to. Oh, no, no. I thought there was no. It ain't no start button. You gotta miss this class. Huh? That's so sweet. 99. Oh, she's so cute. Oh. Everybody in? No. She lied to y'all. She lied to y'all. Where's our prayer come at? Where's our prayer come at? He ain't said nothing either since he been gone. He ain't said nothing either since he been gone. No, I said he hasn't said nothing.
He's talking about this morning, when you been working. I told him school was the dog.
He ain't did nothing.
He's trying to know what to do.
It don't matter. It don't matter which one. Happy birthday, early. Happy early birthday.
I'm being here. I'm gonna be on ice schedule.
Oh God. You know
I
how he
already
said
did
it
my
look.
calculation.
What day your birthday on? Let me check. Alright, y'all in. Y'all talking a lot. Alright, if you got, any work that you need, like, several copies of, then let me know. I know what the purpose is. Or you can, if you don't, all your other stuff, you just work on your study guide.
How about don't study? Don't God.
Even if I do study, don't stick up.
Alright, don't sit, bro. That's your life. Stay a little bit, bro. I'm gonna go get my She was on her planet period and she was making copies.
It's not hope. What you do? Oh God. Yeah, but I gotta use it. It's a risk though. Indeed.
Oh, I saw it. I don't know that when I got
I like them
Don't
all.
try like you said.
I like them. I had it's right. No, it was like jalapeno. I smashed 30 minutes, bro. But the turkey,
Miss here, this is the first time I did video test. I'm in Miss Henry.
It's Harry.
Miss Henry. Wait, that was a test.
That's Harry.
Right, that was a major. It was a major. It was a major amount of rain.
Hey, right, let us see what you're doing.
What?
Let's get some of that. Oh, they did.
Don't let nobody talk.
They let you. I'm good. Gotta get you.
She told me, she said, no, she know my first
Gotta verify your account. I got A's and B's. Yeah, I gotta redo my. My 80s, they gonna play them. I ain't gonna reject both of them. First one, first one. And it's just
I'm good.
on Jesus. You right there, no problem. I got my brain. I can't help it. I can't. You never call the questions out. He didn't have it. Whole bunch of questions, I was so I can help it. I'm a sinner. I just can't. I didn't. I like that video. It's a new week now. I'm not there. I big thing. Getting off. Yeah. But I but I ain't gonna be here on the 15th. That's my God. I feel like so I ain't gonna be here. I just reminded that Thursday. Yeah. I just thought her name.
That's just like you want somebody else to it's just like you want okay, yeah. This got to do, you know,
You know that? You know that?
oh, cause I think I see Did you put the thing?
Look on the back.
Hmm?
Look on the back.
Come on.
Look on the back.
Oh.
You gotta turn yours down.
Nah, I love my spirit. Turn yours in. Like,
You do. Oh, no, no. Okay, but I mean, that's your house over here. Your house over here. Because that's what you said. That's what you got. I know.
I ain't even knew what that was supposed to be a train. Yeah. I heard this on your map. But that's a hard.
No, it's not.
No, my voice is too loud.
It's right there. I'm checking out.
The piece.
Oh. Yeah, it's right here. I'm tripping.
Certified nigga.
Certified. Made by G.
I'm gonna take to another one now. Okay.
My man.
Yeah.
It is refreshing, but
No, bro. I might just be that. You know, I work out. Oh.
Or go crazy 2 years.
How much I get everything? Oh. Yeah, still very tasty. Yeah. I'm just saying. Yeah. Think you gonna be covering? No, right? Then you gonna have no rush. I know you gonna have no rush. Just know.
Yeah.
You gonna be at the old day.
Yeah, you right.
I know.
Yeah. You so. I'm so.
But you trash that, bro? No. You trash that.
Yeah.
You trash that, bro.
Cup phone. Go ahead and get the right cup phone.
I don't play cup phone.
Yeah, it's 20.
I don't play crazy 8, bro.
No, y'all ain't get the right one on two.
I'm the greatest.
Yeah. The greatest. Yeah.
We got group to group now.
I know it's 3. All right, well, all right.
Not bro, hey, everything.
Hey.
I just play chess too. Yeah. I swear to God. Oh, yeah. Not no more. I used to play in 5th grade. I know when you want to do those. I was in the what's it called? That was called gift. Yeah, class. Yeah, me too. Me you. I got a big girl. I got a name. I don't know. She had a brother named. Yeah. I got a name, bro. She's looking at me. Yeah. I've got a name. I ain't gonna get I ain't seen nobody smile. What the other boy name was? Run. I seen her. You gotta be more specific. No. No. I don't know. No. I already did.
Oh, God. Okay, that's a money.
Profile picture change. Around like 6'3" now, bro. And you got full lock. When I'm in 2-3, we had to do that. I know, right? I did that wrong.
Man, you think you're cool?